Hi, today we are going to talk about the prognosis of a major disease called bronchial asthma or asthma or bronchial asthma. That's a disease affecting the lungs and the respiratory tract, and approximately 10% of the world population or more suffers with bronchial asthma. My name is Dr. Rajesh Shah. I am a director of Life Force Homeopathy, and we treat patients from across the world since last more than 3.5 decades. Bronchial asthma is an example of a chronic disease, which is a condition which remains almost for all patients who suffer with chronic bronchial asthma. And this is an example which suggests that only one mode of treatment is not enough to manage this disease. There are several diseases where only one therapy is not going to help, and one has to take conventional treatment as well as homeopathy and other therapies to get the best out of them, and to which will help to manage, control, and keep the disease under check. Bronchial asthma is one of those. Bronchial asthma is episodic condition in which a person experiences the episodes of wheezing or difficulty in breathing or spasm, which may be 2 to 3 times in a day, or it could be once in a week or maybe once in 2 to 3 weeks. Nowadays, patients use inhaled bronchodilators, either corticosteroids or some other form of bronchodilators, and when they get an attack, they simply take inhaler and they feel that they are doing good, but actually they are dependent on these inhalers, and without inhaler they cannot survive for a single day many times. So it's very important that homeopathy therapy has to be thought of to supplement the benefits and to have a faster, better recovery, and also to reduce the drug dependency on chemical-based bronchodilators for life. What can homeopathy do? Well, in the cases of bronchial asthma, in my experience, homeopathy can bring significant recovery, and one may get rid of bronchial asthma in some cases, not in all the cases. And this success is better achieved, especially in the early cases of bronchial asthma. Bronchial asthma affects children, and we'll talk about the bronchial asthma in children separately, because there the prognosis is different than the adult bronchial asthma. In adult bronchial asthma, it is almost lifelong, and the challenge is to keep the number of attacks reduced and to making them milder and less drug dependent. That's the whole idea behind the management of bronchial asthma. And of course, to get significant symptomatic relief in terms of cough, wheezing, and expectorations, and fatigue, etc. So, can homeopathy help in the cases of bronchial asthma? Yes, the answer is absolutely yes. Homeopathy can definitely help to reduce the episodes of bronchial asthma. It can reduce the intensity of bronchial asthma. It can reduce the duration of episodes of bronchial asthma. And it can eventually help you reduce the drug dependency of medicines, bronchodilators or corticosteroids. So helping at all these 4 levels, homeopathy is very strongly recommended for practically every case of bronchial asthma. Bronchial asthma eventually leads to more restriction of the respiratory tract. It may lead to COPD, that is chronic obstructive pulmonary disease. It may eventually lead to more severe form and further infections or some kind of fibrosis in some cases. And if homeopathic treatment is administered timely and for a long time, then there are chances that one may avoid going into the long-term complications of bronchial asthma. So homeopathy is strongly recommended. The cases who are on strong medications, inhaled steroids or oral steroids or injected steroids, they pose difficulty, because once you are on immunosuppressive medicines for longer time, then homeopathy takes longer and it may not really help as per the expectations. So these are the factors to be considered. And what is the duration of treatment for bronchial asthma? I would say, since it is a chronic, progressive and lifelong disease, the duration cannot be determined in terms of just a few months. One may have to take medicine for a very long time. It may be 2 years or much longer, maybe 5-7 years also. It may be lifelong, as long as there's a need to keep the disease under control. So based on our experience in treating a few thousand cases of bronchial asthma in last 3.5 decades, these are some of the prognostic tips and notes that I have shared with the profession. I believe this will help the fraternity, the doctors, the lay people, as well as the students of medicine. Thank you so much.